such a vibrant group joining us this evening, including from organizations such as Bristol Myers Squibb, Microsoft, Deloitte, Optum, JP Morgan, Novartis, Amazon, Goldman Sachs, Salesforce, Medtronic, Sanofi, and more. The current session is on the theme of unleashing the power of AI in healthcare. Today, we embark on an exciting journey into the world of artificial intelligence and its transformative impact on the healthcare industry. We are continuing the series of such events that would ultimately enable and strengthen a community dedicated toward learning, sharing, and empowering women in technology. As we all know, the intersection of technology and medicine has given rise to a new era of healthcare. The integration of artificial intelligence promised to revolutionize diagnostics, treatment, patient care, and administrative processes. Today, we have gathered some of the brightest minds in the healthcare and AI domains to shed lights on this burgeoning field. herDIGITALstory is an initiative by Cigniti as we continue to work towards our commitment to build a diverse and equitable tech ecosystem. To unveil more about the concept of herDIGITALstory, I would like to invite brand custodian of Cigniti, who has played key role in shaping our brand identity and values. Please welcome our Chief Marketing Officer, Mr. Sairam Vedam.
Good evening, everyone. At the outset, first and foremost, thanks, Tanya, for calling me here. I would like to welcome all the esteemed leaders who are here, and also we have the leader from NASCOM. Thanks for coming in here. On behalf of Cigniti Technologies, why don't we just give a round of clap and applause. I would also like to acknowledge the presence of my fellow leaders, Nanda and Karan, from our leadership, along with Urmila. Thanks. I'll just take 5 minutes. This is something very dear and close to our heart. The of Cigniti Technologies, our vision is to help build a better future through technology-led transformation. And we believe anything that is digital, right? That's the modern word, so to wear. But healthcare is something that, as a company, even from a corporate social responsibility standpoint, we do a lot of work in the capacity that we could, either equipping state-of-the-art infrastructure at hospitals. Very recently, we did something that actually funds medical education for deserving students through a very large NGO. So coming back to this, this is an initiative that actually came to us. The roots of it, goes back to a company, Round Square, that actually we acquired, and Sirisha is there. Now, Round Square is a proud part of Cigniti family now. It's part of our digital engineering. And we are a born quality assurance, digital assurance, software testing company. In the last 12 odd years, we've sort of trailblazed this whole thing. 700 odd enterprises trust us. Today, 200 plus Fortune 500 companies work with us. But the future for we be very, very responsible that we think to embrace a thought where it's about conversations to embrace tomorrow, as herDIGITALstory says. And there's just not any better method than this to sort of invite, discuss, learn, and share from a fantastic constellation of women leaders. And that comes right from our founders' vision, our chairman's and our CEO's vision, to have celebrate, recognize, acknowledge the indomitable spirit of the most gifted people on the planet. So we are here to learn and share from each other. And just to give a little dimension, the first edition of this, I think we delved into intricacies of large language models. And today I think it's even exciting topic when predictive, prescriptive, hyper-personalized, tech-led healthcare is the order of the day. And I couldn't have asked for a better set of speakers than this. My weakness, this entire company knows, is to continue to talk. So I'm going to stop myself and welcome all of you. And thanks, sir, for also being here. And I hope we'll all have an enthralling session. Maybe just play the herDIGITALstory video once before we take it further.
Sheryl Sandberg says, no industry or country can reach its full potential until women reach their full potential. This is especially true of science and technology, where women with a surplus of talent still face a deficit of opportunity. Technology has always been shaped by women. From the early days of computing, when women made up a significant portion of the workforce, to the present, where women continue to push the boundaries of what is possible. Whether you dig into history or look around today, the industry is only wealthier with women. herDIGITALstory is a community of practice where women passionate about emerging technologies can come together to connect, collaborate, and grow. Our mission is to inspire and empower women to pursue their passions and become leaders in fields like AI, ML, data, and blockchain. This community aims to be a powerful force that drives conversations forward with stories. We will unlock new perspectives and insights to help us better understand the challenges and opportunities. By empowering and amplifying the voices of women in tech, we can drive meaningful change and inspire the next generation of innovators as we uncover new solutions that can transform the world around us. Come together and harness the power of this community to create a more inclusive, diverse, and equitable tech industry, to use our voices and our stories to challenge the status quo, push the boundaries of what is possible, and shape the future of technology for the better. Join us and share your digital story.
Initiative of how brand Cigniti is committed to this wonderful mission. To take the session forward, I would like to now invite Sirisha Peyyeti. She is the Senior Vice President of Digital Engineering Services at Cigniti. Sirisha is a business leader with nearly 20 years of experience in the IT service industry. Her expertise lies in solution consulting with a strong focus on digital thinking and customer empathy across multiple domains. Like this, I'm for a minute worried if it's me or somebody else. So yeah, I do have 20 years of experience, but I think one of the nicer aspects of it is being there in the industry and seeing how it's grown and how it's changed. Not so tech evolved, I guess. I still have a piece of paper that I want to use to kind of keep track of what I wanted to say, but this is truly an honor. Again, when we started, like Sairam alluded to, when we started this initiative at Town Square, it was a very, very small community. We just wanted our employees to have visibility to what's happening in the industry. And we wanted this to be a very, very informal meetup sort of an event. It continues to be that and a lot more today. We couldn't have been able to attract the kind of speakers that are sitting here today at that point in time. So I'm really, really glad that this initiative's taken the shape. This is the second edition of our digital story. Yeah, we had a very interesting session the previous time around, and that was on large language models, and we had people come in and talk to us, and at that point in time it was still very, very new, right? People were still figuring out what LLM is, just because that meeting actually helped us to understand that LLMs are beyond ChatGPT. Yeah, so that was the big takeaway from that conversation. Today it's a lot more interesting because we have someone who's a doctor who's in the field. We keep talking about tech impacting industries, impacting domains and all of that. How often do we actually see the impact that it is being, that it is creating, right? So if we have someone from the community come and talk to us and say, this is what we deal with on a day-to-day basis, that's going to be a lot more interesting perspective than going on and on about tech, I guess. So Dr. Jayalatha ma'am, thank you so much. It's an honor to have you here. She is a director at MNJ Cancer Hospital, a renowned radiologist, but more importantly, a tech enthusiast, which is possibly one of the reasons why she's come out of her comfort zone to hear a lot of people talk about tech today. But thank you, ma'am. Really, truly honored to have you here. If you could say a few words and inspire all of us here, that would be really, really nice.
Thank you all. Good evening. I didn't think that it is so much elaborative crowd and a high-tech crowd over here. I just came ex step and saying that I would talk about my story, how I became a director and a hospital as a woman, my challenges day to day which I face it, but it's all a different platform here. Now I can find myself to a digital imaging and also AI and machine learning. All these are new terminology for us. Though as radiologists, I do come across because we day to day we deal with machine learning, AI, especially when early in life, when I became a first resident in my Usmania Medical College, the CAD detected lung nodules have come up with CT scan as an event. So CT scan was evolving those days. The CT is nothing but you all know the cross-sectional imaging which we do for diagnosing lesions. At that time, suddenly they said CAD detected lesions. CAD is nothing but a computerized aided detection of lung nodules. It was new for us, and that was the only term which made us attract towards that missionary, which was exclusively having that component. So we went ahead for that and we purchased, which was with a high cost. And that turned out to be, I think I remember I discussed these things with one of your Sairam and the rest of the staff who had come to us. That was the nodules, which were less than 5 to 1 mm, which are detected through computerized in a lung, which are supposed to be diagnosed as a metastatic nodule in a already diagnosed case of lung. But that was giving us, though we were taking the aid of that, but that was giving a false identity. I mean, the nodules, which are end arteries and some other naturally present normal anatomy. Then I was little taken away. So many nodules which we never diagnosed earlier, and unless it is 1 centimeter and above, usually we don't give so much importance. But suddenly, all the cases were diagnosed as metastatic lung disease because of these CAD detected nodules. Then I discussed with some of our colleagues and also the technologists who come to repair our machine and attend our technical aspects. Then they said, yes ma'am, this is a positive outfit. So we come and we go back and then work on it. So later on, so many inventions have come up. The artificial intelligence and especially because I'm working in a cancer backup, we are very much investing on detection of early malignancies. That is the only way to keep these days, especially the individuals like you who are evolved and involved in the tech jobs, those who doesn't give any 5 minutes or half an hour of your time in an entire year, those are coming out with an early malignancy which are undetected, are going unnoticed. And for this, for your, the AI is giving us a best solution in detecting undetected nodules and hidden nodules, especially in breast where AI-based reading is happening because there are less number of radiologists, less number of pathologists who are present to diagnose the lesion per se. So where AI is used and those, the normally unnoticed lesions are, though they are false positive, false negative presence are there, but still it is coming to our notice, it is being noticed, it is being diagnosed further ahead with further testing, and at least 50% of them are again re-diagnosing as not present. That's a huge reformation in health aspects, I say. And apart from this, the AI-based technologies like robotic surgery and other, especially the cancer dissection and cancer per se, AI is used very much. And as a radiologist, actually it is threatening us as a radiologist. Our jobs are threatened now. Earlier, it used to be diagnosing a mammography, diagnosing an ultrasound, a radiologist given a higher post, high paid, because of these smaller things which are happening. But your machine learning and all is taking away our jobs, detecting all these lesions in much early way, and then, but in the other side of the coin, many things are detected, many things which are unnoticed, which used to present in an advanced cases where we're not able to do anything, are presenting in an early case, giving us a hope that it can be treated, it can be prevented. Everything can be done in a organized way. Everything can be taken up initially by whatever machine learning or AI technology and come to the next level of diagnosis. And so much of help happening to the women these days, especially the women who are multifaceted, multi-targeted, all multi-diagnosed. So those don't have time, especially I see in our own profession and also in educated profession who come day in and day out to us. Usually they come with a push with somebody or they don't come especially at all. Even if you include your incentives in your salary-based incentives, if your yearly checkup is done, if they come out with the checkup, that is usually in European countries and all, they tie it with for their salary. Their medical sheet should be concerned with along with this thing. Unless and otherwise your medical routine checkups are done, unless that is teamed up with your this thing, your incentives are not added up. At least with that scary thing, then people get checked up, people go for a screening, early detection, and they come out with lesions in an early. Here in India, that sort of culture is not there. Actually, even in educated people. I see in my own, the other day I have seen one of the doctor coming in an advanced case, unnoticed. And when it comes to their family, their own children, their husband, and when it comes to their own self, it is the least importance. As that is the main advice which I wanted to give on this platform to you. Apart from your routine, your jobs and hectic schedule, which you name it, but please give at least 15 to 20 minutes of your time for your own self. Give a reassurance and then go for a routine checkup. And these small things like your menstrual deformity or alterations, I don't call it deformities. These things also should be given importance apart from your routine life, because these are the things which are taking away our health and wealth and ultimately landing up in the problems. And as a director of the hospital, I face so much of challenge. In spite of being a radiologist, a professor for so many, a PG teacher and a researcher, in spite of all that, there's so much of competition, so much of the differences in the department and outside the department. But still, if you're strong, if you're healthy in mind, if you're positive in attitude, I think sky is the limit. The same advice which I wanted to give it to all youngsters over here, and then all the patterns of life. We are coming out with so much of technology. But I also advise you to a post-COVID era, which we call it as AI, and your technologies has helped us a lot in segregation, in treatment aspects, in detection, in simplifying the methods of triage and the treatment aspect of it, especially the post-COVID era, which I would call it, has helped us a lot and also forced us to learn these things. Usually we don't know, we are not attached to all these. It has forced us, it has made us challenging, because unless you know these aspects, you're not supposed to, these technologies and all, the pattern of the performer has changed altogether. So unless you uplift or upgrade yourself, it's going to be difficult. As I said, as a radiologist, it is a threat. And even now, the other day, we are doing a trial on a pathology. Screening for village women every now and then, every alternate day, our team, along with the inbuilt technology in the bus, which is again helping us, the mammography, inbuilt pathology screening within the bus, ultrasound abdomen, and also oral examination, where technology is helping us to detect, to denote, and define which type of lesion. We are going into the doorsteps of the villages. We are going to the door and the primary health centers. We are making mass screening. And in this mass screen, if you see, one individual can do up to 100 or 150 patients in a day. But if you want to screen 500 and 1,000 patients on that particular, because we are taking all the technology. That is where the primary requirement, we need a technology. That is where the primary requirement of the technology is necessary, and where you can screen a mass of 500 and 1,000 at one go. If the slides are given, the pathologist yesterday was discussing with me. If we buy that technology, it has already come up in the usage, where all the slides are screened and only the positive cells which are present are segregated out, and that can, the pathologist can see only those 10 selected slides and give a diagnosis on that, saying that this particular lady has primary initial stages of whatever pathology or malignancy in it. That is the large scale difference which is making technology there. See, you are cutting down the hands, but at the same time you are the usage to the community, especially the public health, especially the needy people, where unless the technology is used by the needy, it is not given so much of importance, I think, in my profession or in your profession. So it is giving a solution to us, where one person, we are restricting ourselves to screen only 100 to 150 because our gang is only 10 to 12 people, where one radiologist, one pathologist, one a technician and one nurse with us. So if this technology is added up, we can screen 1,000 at one glance and then segregate the people and cut down the numbers and only treat the needy ones. So this is the help which we are getting. And I would think and then aspire in future, so many of such solutions come up which are used by the public, which are used by the society. If it making such a difference to the society, it's really a wonder, and it's a success of the technology, which is not confined to the four walls. It's going to the periphery, it's going to the utility service where it is used by. And again, I thank Cigniti and their group. They've helped us in establishing a ICU setup in our hospital, and that ICU with an inbuilt ultrasound at bedside and also the monitors, which is being used by the needy people. Since ours is a government hospital, which we, it's a state level cancer institute. Though we have all high-end equipment, but some of the gaps which are still there has to be completed by a philanthropist or a work group of such a large scale, which come up and help one another. Unless that happens, we cannot make a solution or find a solution to the problem. This is what I really appreciate, with no intention of any other thing. They've just come up with a social activity. They were all there to inaugurate, and they felt so happy looking at the patients, being happy about looking at all the equipment, and we dedicated one entire room with an ICU setup exclusively dedicated to the Cigniti and their group. Really, I thank Sairam and rest of the people. It is actually one of the patients also wants to share her experience of usage and all, which I pass it on to you. I'll give her number. You can directly talk. Like that, 3 or 4 people who want to share their thing. And on as this platform, I want to make use and then tell everyone, please come out of your zone and then come out, look at a larger scale, think at a larger scale, where things are used for, at the end of the day, it should make a difference in a life, and also used by a larger society and also the public health, which is really making a lot of a difference. And again, I, as a women employees, you are all, majority of them, please give importance also to your health and also to a small part of your life to come out of your zone, give some time to your health and also to the extracurricular relaxations and also the other activities. Please also do give importance and look at, unless we are, depends upon the women health. So please do take care. Any suggestions, any help, we are always there. Take care. Any suggestions, any help, we are always there at your this thing, because we get so many of them, so many other problems. I just don't want to scare you. Infertility problems, so many other routine problems. So they do occur because it's all a matter of an hormonal changes which are happening due to stress or due to other work stress or other stresses, please take yourself light and also focus on your health too. Thank you so much for giving me this opportunity. And as I said, Nikki has told me to be myself and be not to the AI or whatever it is. I thought I'll just talk about few things which are important in life. Again, thank Cigniti and their entire group, and also encourage them to come forward, step out of your field, think large. Thank you.
I just wanted to acknowledge the vision of our founder, Mr. C.V. Subramaniam, and our CEO, Srikanth. I think it is their vision and their thought process allows us to come and do this sort of activities with the hospital. So I think a round of applause to our founder's vision. That's more important.
This is what I was saying. Again, rest of the world probably is a little far ahead when compared to India, and when it comes to having a visibility across the spectrum, right? So we are all generally confined to what we are studying, where we are working, the society that we live in, the compound that we live within. We don't step out, we don't share knowledge, and we don't actually look at the larger picture. Maybe things are changing and changing for good. The fact that in an IT session focused on AI, we have a doctor speaking, speaks for itself. So, and the problems haven't changed, ma'am. Everything that you mentioned, CT scan, the false positives, those are still there. So that's exactly the reason why we need collaboration. That's exactly why we need to understand what we're doing. And again, we ourselves as Cigniti, from a tech point of view, we worked with one of the hospitals in Hyderabad, and we built an AI algorithm that will help detect chronic venous insufficiency. Again, a standard problem, often neglected. There is no real reason, rhyme or reason for when it will come and what the progression of the disease is. So we've been able to put together an AI model that assists with early detection again.
We are here to help you all to give a model or give a pictures or give a mammograms. You can arrive at our algorithm where it can solve our problems. And then here as a hospital and then material, you get huge. Because being a state cancer hospital, the material and the patients which we get, and the feedback which we have is a huge. People like you should come forward and make a collaborative workup and then start giving us solutions.
Absolutely. Again, that's the other important point. All AI models are only as good as the data that we have. So yeah, that's the other thing that's again, hopefully changing for good in India. At one point in time, I don't think we had a lot of open data sets to work on. Even today, if you want to go ahead and do voice, text to voice, or voice to text, or text to speech, or even images for that matter, you typically have Caucasian faces. You wouldn't have a lot of Indian faces there. Right? So things are changing, hopefully with the support of institutions like what Madam was talking about, or organizations. And maybe when you talk to universities, you can bring up that point, Vani, about collaboration, open data sets creation and stuff like that. So it's always an interesting influx of technologies and capabilities, I guess. And on a lighter note, ma'am, my brother is a radiologist too, in Continental, and we constantly have this conversation around radiologists being threatened. So I tell him that I am a pseudo doctor now. so yeah, it's not so much about threatening. I guess it's more to do, like ma'am mentioned, assisting and creating speed in the overall process, right? So as much as possible, if you can bring, it will absolutely have impact at scale. So yeah, very, very thrilled to be a part of such conversations. Okay, next we have Vani come over and do her presentation. Again, I could go on and on and on introducing her. So she is with Bristol Myers Squibb, and she is today, she's obviously done multiple hats in that organization, been there for a very long time. Currently, she's head of their IT culture and strategy. But more importantly, she's on a mission to ensure that in India, in Hyderabad especially, there is diversity, there is technology, there is awareness of what BMS represents, and build capability competency here. She is going to be working with a lot of universities, a lot of likes of NASCOMs and HICRs, etc., to bring that awareness, build the talent pool, and make the Hyderabad office as effective, if not more, than the HQ. Yeah.
Thank you for taking the time to come here, and I think this is a learning opportunity for you, and you're actually making use of that opportunity. And I'm really looking forward to sharing my experiences and also hearing from my other fellow speakers here and learning from others' experiences. So I was asked to do two things. One was to share my career journey, and the second is AI in healthcare. So I'm going to do both of them. So before that, I think just to kind of set the pace of where I work. So I'm at Bristol Myers Squibb, and just we are major biopharma company. Our mission is to discover, deliver innovative medicines to patients globally. And when I'm looking at this, we're really proud to be part of the 165-year-old company where innovation has been at its core. We invest quite a bit in R&D. You see the $9.5 billion, which we have about 50 plus unique clinical assets in clinical development. Patients are at the center of what we do. That's very key and important for us, and it's kind of our North Star. We are in about 85 countries with over 1 million patients. Just going to talk about like the 4 therapeutic areas that I want to highlight, which is immunology, hematology, oncology, and cardiovascular are some of the areas that we are in. Our people, extremely important for us. We continue to focus on our people. We have about 34,000 employees. On this when I talk about my story. So we have people and business resource groups. I'm sure there are many places where there are communities that come together. It's like the Women's Resource Group, the Veterans Group, and the other organizations. So just moving, so before I go into my story, I actually wanted to bring this up. So this is by Steve Jobs. You can't connect the dots looking forward, you can only connect them looking backwards. So you have to trust that the dots will somehow connect in the future. Now this spoke to me quite a bit for my story, because I'll share a little bit, and you'll see that when I look back, I'm in Hyderabad, but everything that I've done the last 25, 30 years have brought me to Hyderabad. And so that's why I wanted to highlight that first before I go and start connecting my dots here. So my journey in Bristol Myers Squibb began in 1997. And whenever I think of my first day, so right now in Hyderabad, we're almost every Monday, we have an onboarding day. I mean, inviting people and, bringing them on. So I always go back to what my first day looked like. So this is what my true first day was at Bristol Myers Squibb. So I came in, my boss, wonderful person, Hugh Sloan, welcomed me. I said I was very excited to join BMS, and my next statement to him was, I'm pregnant with my second child. And he didn't flinch, congratulated me, took me around, did all my, had the same work that he had assigned for me. My colleagues were all, and at that time I was the only woman, didn't matter. We worked, did the same amount of work, and the only thing they would joke is that they would actually have to take me to the hospital, and it almost happened because I worked till Friday. Saturday I went into labor and Akhil was born. so that was my first day, and so you can imagine what I'm bringing along with me. I've been there now 26 years. And I still remember that first day and how positive it was, and that really, makes me kind of give back more to the company too. So I looked at the next, till years of growth. I've done a lot of lateral moves. Almost for 15 years, I didn't change my level, but I changed my roles. Every 3 or 4 years, I took a new role. And with those new roles, I took additional responsibilities. And so that's why I call this the year of growth. And I also did business certificate at Wharton. So I've kind of started building some of those skill sets. I didn't know where I was going, but I started building those skill sets. And I've also moved within the different divisions within, all in IT, but I was supporting the different areas between the different divisions at Bristol Myers Squibb. And then in 2013, I really felt, okay, technically I'm strong, but I really wanted to work on my leadership skills. And this is where I spoke about in the previous slide where I said the people in business resource groups. So that was a good resource. So there was a business network of women. And I'm like, okay, let me join it. But just joining is not good enough because you have to do something. So I took a leadership role there. And at that time, they wanted to do a STEM program for the underprivileged in the community. And it was just a vision. And I was like, this is wonderful because this is the area that I want to grow in. I joined there. We were about 4 of us and we each took a role. So my role was external engagement. And Sirisha was just talking about, I'm here to do some of the external work. So it was the external engagement. So as part of the external engagement, I set up a collaboration with an organization called 4H. And then we branded it, it's called Tomorrow's Innovators. And now, 14 years later, it's still sustainable, we still have those programs and they're still continuing. And so I just wanted to highlight in terms of the growth, there are different ways for us to grow. We grow technically, but we also have to kind of start growing outside of our technical comfort as to how do we grow with the other soft skills that we have. If what I did there did actually got me the job, the IT for strategy and business development. Because if you look at a role for strategy and business development, this is mergers, acquisitions, and divestitures. So you are the head of IT. You have to do those negotiations. You have to be there. You don't have a phone a friend. You're sitting in a negotiation. You're representing IT. You got to make decisions. I would not have been able to do that if I didn't get comfortable speaking outside, if I didn't get that confidence to do that. And of course, the years of growth gave me the technical expertise that I could actually take to the table. So I did that for 4 years, and then last year, actually last September, August, our Greg Myers, our Chief Digital and Technology Officer said, hey, is anybody interested in going to India and helping set it up? So I did raise my hand. So I've been on this project since last September. I moved here 3 months ago. It's already 90 days. I'm here on an 18-month assignment. Absolutely loving it. Hyderabad is a very welcoming city, and just be me invited to be here and meet everybody. So it's excellent talent, and so this is just a little bit on my journey and how I got here. Now moving into AI. So even AI, I'm going to, again, it's part of the story that I'm going to kind of bring along here because there can be conventional and unconventional ways with which you learn and with which you grow. And my venture into AI was a little unconventional, but it's more in the VC space, I should say. So when I took on the IT for strategy and business development, I've taken on stretch assignments wherever I went, whichever role I was in. In that area, there was no digital health search and evaluation in the business development organization at that time. So the BD head, Paul Biondi, had asked me at that time, do you want to take this on? And I said, I knew it was a stretch, I knew it was a lot of work, but I said, why not? Let me take that on. So I led digital health for 2 years, the search and evaluation. And as part of the digital health search and evaluation, I have met with hundreds of companies, have done evaluation of their offerings, and we have an event at JP Morgan every year that we go to meet potentials. And I've led those JP Morgan meetings for 2 years. And this is where you actually sit across the founders, you sit across the different CEOs, and you get to hear their passion, you get to hear what they're doing, why they're doing it. Their stories actually are pretty moving. And that was my first venture into AI. I remember the first thing, I must have organized, of course there were about 100, 150, but then you kind of narrow it down. So I must have met about 30, 35 companies. And 99% of them came in with one slide which said, we are an AI company. So everything was AI. The first, my first, so I had with R&D was more of the innovation day. And we did the hyper reality. That was the first thing I did. It's like hyper reality. Because there was so much talk about AI, is it real? Is it not real? Do we have enough data? Do we not have enough data? But we did have a few, we continued watching it. In some areas it was a little bit more advanced, like speech recognition, NLP, EMRs. Everybody was reading EMRs. Everybody you spoke to were reading EMRs. So it was growing, and then of course you had your, your deep learning techniques that were approaching. So there was a lot of work going on, and we could see that evolution. And we at Bristol Myers Squibb, we were also starting to experiment and pilot some of the work there. While this was going on externally, internally we were starting to build our own data sets in terms of how do we want to look at our clinical data, how do we want to look at our real world data in there. So we were slowly starting to kind of build, and that's when the data scientists came in. So there was a lot of work in terms of the digital predictive and analytics using AI ML. And then we started moving towards the cloud at that time. And then somewhere around 2020, MLOps came in to provide the structure around it. So we continued, and we still continue to do that. So today when we look at, and I think Sirisha, you said that, one of the questions that I always asked when the companies came to meet us was the bias in the data. Because I know in certain areas, it was the facial recognition was there, and so there was a lot of bias in the data. So where are we today? I can't say we're totally out of bias, but I think we are a little bit more advanced because we have more advanced data sets. We have the ability to now a lot of the off-the-shelf algorithms. So I think we are at a much more advanced stage, which is actually letting us experiment more, I should say more confidently than what we did before. So, so I just spoke about Greg a short while ago. So Greg, if you follow him on LinkedIn, he's all AI in healthcare. There is a very good YouTube conversation with him where he gives a lot of details on AI in drug discovery. And so what he has done is he's really kind of elevated how we think about technology in here. And what do we mean to the business? Like we are right now, when I look at IT is very integral to the business and all aspects of the business. So when you're looking at, be it, so I'll walk through, we have research, development, we have our global product and supply chain, commercialization, and we have enabling functions. We are very much integral and we're embedded in all aspects of it. And so I will talk about 3 examples, and I think this is all it'll all start sounding very familiar because when we looking at healthcare and what we're talking about. So the first one is in the area of research. So we truly believe the power of science to be able to tackle the most complex of healthcare challenges. But computer science is becoming equally important as your chemistry and biology. And the computer science along with our AI and ML, may as well not use that because that's the topic, but the AI and ML, it's really changing the way we discover and develop. It's absolutely making a difference. Biology is very complex. And when you're starting to think about a scientist reviewing something, it does take, there's a lot of data, a lot of data sets to go through. So if somebody has to manually do it, when I say manually, it's it does take a lot of time. It's time consuming. And traditionally, when you look at research, it's experimentation, it's trial and error. So what we're hoping with our AI, ML, and other technologies is to be able to parse through those vast data sets and to be able to help and assist the scientists in narrowing it down and giving them more real data sets they can work with. So I think that is one of the areas that we are definitely very focused on with AI and discovery. We do partner extensively at Bristol Myers Squibb, so we are partnered with small and large drug discovery firms. And these firms use AI and ML in different aspects to reduce, or I should say to increase quickly, come up with in the R&D phases. And some of those areas are, you have your RNA sequencing, your gene splicing, and protein folding are some of those areas. So, and again, AI and ML is a very important tool for our scientists to be able to take work along with it and to be able to kind of move quickly. And our outcomes that we always want is better medicines for our patients quickly. The second example is AI enabling clinical trials. So if we actually look at, again, going back to traditionally what pharma company is very good at, is we know our drug pathways. We know, the treatment pathways. So we are very good at that. So what we're doing here is taking the knowledge that we have in-house, taking the learnings that we have historically, and then combining it with data, internally and externally, to, again, predictively help our scientists do it better. So that's, and if we look at the data that we have, it's like, this is for years we've been collecting all this data. So it's anywhere from molecular to translational to, your imaging, clinical, your real world data. And what we're hoping to do with this data is, these are all like puzzle pieces, no? So how do you kind of put them together and help us learn the biology of the disease? So that's how it all comes together magically. And it's not magically because behind the scenes you have your AI and ML working the magic there. I actually put this slide up because there is sometimes a misconception that as AI and ML is coming in, not in the case of radiology, but in the case of a science here, is we don't need as many as the subject matter experts. But that's not true, because we have found that there's a different type of subject matter experts that are coming together. And that's why I pulled up this quote from Marianne, where we have cross-functional teams. You have biostatisticians, computer scientists, you have your development teams, you have your IT, chemists, biologists. They all come together to be able to work on this. The example I have here is we have partnered again with an external, with a AI company that's helping us optimize clinical trials in cardiovascular. So here, they take real world data, they take off the patient information, and they produce the outcomes that can help us get a better set of patients, which again is more diverse and which is much more comprehensive than what we were doing it in a traditional way. Now, this one is, again, everything is going to start sounding familiar, because once you start putting AI in places. So we also have partnered with another international AI firm for an algorithm that actually reviews the electrocardiograms. And what it does is it's looking for abnormality called HCM, which is hypertrophic cardiomyopathy. It usually goes undetected. So this condition actually, it causes the hardening of the heart muscles, and a patient who has this has to have some invasive surgery, and a lot of times it's not detected. So we have an algorithm that actually detects that, and it will notify the physician, and then they can run some additional tests. So these are just kind of some of the examples that I put together where AI and healthcare are coming together. Okay. And then again, do I believe it has the potential to revolutionize? I mean, we've been watching it for a while. I think it's only going to get better, and ChatGPT is everywhere. We're closely watching the generative AI. We're also experimenting with open and closed source code. So again, we have to keep our pulse on it, and we have to use it appropriately with all the guardrails that we have in order to kind of use it more effectively. And then even if you take off, like when we look at enabling functions, when we look at how we, like automation is a big one. And the reason I think about that is, what you're doing here is you're taking away some of these transactional, repetitive work, so the experts can actually focus on the more strategic work. So I think that's another aspect of it. Indirectly, it's also helping the patient. So I think that's another angle. So I actually put this one up because again, we're talking of ChatGPT. So I visited Udaipur last week, and we were driving from Udaipur to Kumbhalgarh. On the way, it was like pouring rain all over, pouring. But one scene was common. It was a 2-hour drive, so 1 hour 15 minutes it rained. So that 1 hour 15 minutes, I saw women, mostly it was women, who were carrying fodder for their cattle. And in the rain, they didn't care, they were just going. In fact, we stopped and I asked, can I take a picture? They actually turned around and smiled. So this is exactly what I put into ChatGPT. And I said, write me a blog. So ChatGPT wrote me a blog. And this is something that I was thinking, but I couldn't express, but ChatGPT did express it for me, and I want to kind of highlight that, As I walked away, I realized that I was just witnessed something special. It had given me a glimpse into the life of these hardworking women who are not afraid to face the rain and do what they needed to do. And for me, this was very profound. And I think each one of us, I think we're all caregivers, mothers, spouses, daughters, and we do a lot. And I think above all, we are technologists. So I think we have the power. We can do whatever we need to do, and I think we shouldn't be afraid to take that step to do it. So with that, I want to close it out and just say power to all of us.
We will have time for questions once the other speaker is done too. And the fact that it is all repetitive, it's all sounding the same, actually emphasizes the fact that technology is actually going in the right direction. We're at least talking the same thing. We'll figure out how to get there. And a couple of things that I noted that I thought were relevant for us to kind of use as key takeaways. The hyper-reality that started way back is still the same. So it's going to stay the same. Nothing's going to change in that context, right? So anything that's coming up new, I think it's extremely, extremely important to focus on what the use case is and why are we doing it. Technology, if it's an enabler, I think it'll take us places. If it's used just for the heck of it, I don't think, somebody like Nita will find it out and not invest in that anyway, right? So again, drug discovery, the use case is phenomenal. And to Vani's point, wherever you have large amounts of data, in fact, wherever you have data from different modalities, like she showed us with regards to, say, a CT scan versus some other imaging to actual EMR data. So if you have multiple modalities of data, how do you even make sense of it? if you were analyzing it without using machine and machine-based techniques, I think that's very, very relevant. One other thing that I want to talk about, again, all AI implementations doesn't have to be, high profile, extremely sexy. No, it doesn't have to be. In fact, one of the customers that we worked with, we used AI in the clinical trials aspect, but we used it for a very, very different purpose. We said, typically when somebody comes for a clinical trial, they're supposed to, know a certain things. There's a set of questions that they have to be apprised of, they should give their consent, etc. Most often than not, it's not a malpractice per se, but there are certain questions that get ignored. So we built a platform using, again, text to speech to text rather, and then we analyzed and told the caregiver there, or the clinical trial expert, whether all questions have been addressed or not, just to ensure that there is no, after all the good work that you do, you don't want that particular record to be taken away just because you've not followed certain guidelines, right? So this was a company called Trier that got acquired by Velocity, and then they're a part of that team right now. So it was a very interesting use case. You wouldn't think that, why would somebody want to use AI there, right? I could use it for, churning huge amounts of data and generating insights out of it and automatically figuring out which drug is better. Yeah, all of that happens. But there's a lot of grunt work that can be automated as well, and that gives the experts, the subject matter experts, time to focus on something that's more interesting, right? So thank you so much. Reiterates everything that we spoke about. The next speaker, again, Nita, she's a venture capitalist, and if you think women in tech is a rarity, that's probably a rarity of rarity. So yeah, very, very glad that you could make it. Again, she has extensive experience working at the intersection of business solutions, technology, and innovation. Again, extremely keen for us to notice that it is not one skill that gets you forward in your journey, in your career. It is an intersection of skills, and Nita is a great example of that. She currently works with India, but then she has prior experience with a lot of firms, Medtronic, Map My Genome, Scient, companies that you would all recognize. So she's an early stage VC, she's a strategist, she's an innovator, she's a scientist, she's a doctor, and an ecosystem enabler. Without further ado, Nita, take it away, please.
Not making slides, after seeing beautiful slides of Vani, and then, amazing talk by Dr. Jaya as well. So thank you for having me over, and I'm so glad to see a lot of men here as well. Usually if they say women in tech or like women talk, a lot of men think that we're not supposed to be here. But good to be here. Thank you for inviting me, and thank you. I thought, let me also say that, when Tanya called me, she said, what are you going to title it? I said, really, I thought this was like supposed to be a free-flowing conversation, and that's what I had prepared for. But then I'll give a little background about myself, how I got to what I got. And none of this was planned. I think all was more serendipitous and more passion-driven. Definitely didn't plan to be a VC. I think it's just curiosity which got me to where I am right now. And I think every day is a curious day, and that keeps me on my toes. Always ready to learn. Definitely not, I don't sleep a lot, which is not a good thing. I need to sleep a lot more. So I'll just maybe start off with my life journey, what I started off with. My father was a scientist, so I thought first let me become a doctor, but then I wasn't really cut out to be a doctor. So I became a scientist, and just I guess different parts of that took me to US, worked there. Then some, there was a different life change. Said that okay, my husband was moving back to India. I said, well, I don't want to move back to India. This was like almost a decade and a half back. But then I think I can't be happier than the place where I am at, and being an ecosystem enabler, and very, very happy to be where I am right now. And none of this would have happened if I wouldn't have made that shift from being a scientist to what I am right now. So we came back to India. I had very young babies at that point. So again, going back to when you said that, you work through your, having your child, and I think a lot of us, I think some of the girls are very young here, but then others can identify about having a child and how you're going to juggle with your career. Didn't take a break. I decided that I can't like really be a stay-at-home mom ever. So I think a month back, and I don't suggest any of the other ladies to do that either. But then you do what you have to do. So always work through. But when we came back, I think that's when I took a little bit of break to really understand what I really want to do. And I think that was more of a pause and important for me to really understand that whether I want to continue being a scientist. But then I thought this is a great place where you come back to India and you can follow your passion. And I really wanted to work on the interface of technology and like really bringing the science to the market. So I joined Indian School of Business, really to first understand what does it take to get the innovation to the marketplace. To work with some amazing pharma companies both in India and in the West. So sort of learn what happens in the West and sort of adopt it, but then realize very quickly it doesn't happen like that in India. India is very local market. We have to change, we have to adopt. And I think that led me to sort of become the founder for the incubator at ISB, which helps more technology-driven business solutions to the marketplace. And that was just a stepping stone. And I think what I'm trying to say is like, I just went as it went, right? Like I think it was more about passion-driven rather than, hey, let me connect. I want to be this. And so that was my starting journey of really, being close to where the solutions are being developed. So saw very early stages of like startup ecosystem in the country. It was 2013. Subsequently, I think things were very slow. I said I want to really work with startups, so I joined Map My Genome, which was again in the genomic space, but then moved more on the business side, deeper and deeper into that. So after some time, then I started to do some of my own startup work, more in the EHR space, electronic health record space. I think that again came from like having a dissonance of being frustrated to carry this file of medical records to your doctor, which still happen, and it's very frustrating. So I would go to a doctor and realize that you still have to carry your medical records. It's really tough, to explain your entire history of medical, whatever your medical issue is. But then quickly realize it's too early again. The ecosystem is too early. There's no digital adoption. There were no computers in the hospitals. I think the only other hospital which had digital one was the Continental Hospital. And then continue to, what I realized even premier institute or hospitals like Apollo did it mostly for billing purposes. Your digitalization was for billing purposes. I don't think they do much of digital health records even now. So I think the reason I'm saying all this is that while when you said, sometimes the solution doesn't have to be very complicated, it can be very simple, solving a solution, right? You're trying to do one step at a time. So again, I realized that this was too early for the ecosystem, and then I joined Medtronic for some products. Then I joined, Science as well. Adarsh is here, ex-colleague from Science. So did some very fantastic work there, and at the same time, again, I started doing my executive MBA at ISB because I realized that while I was working on the business side of things, I think having an MBA in a country like India is equally important. So while, I think the reason I'm repeating all this is that juggling multiple things. I think as a woman, we juggle multiple things, and I think we are very good at connecting the dots. And the reason I'm saying, I actually wanted to title my talk as Connecting the Dots. And I think that's something being very, very, I think part of my journey is that, I think as a scientist, being very curious is like a top thing about me. Deeply passionate about what I do, and being able to connect dots, not just in what I work. Again, I'll talk to a whole bunch of people here, but to be able to see, okay, it's AI, ML, drug discovery, it's patient record, I think to be able to see if there is a pattern, right? Like, it may not come up, it's more like a eureka moment, more of like a, okay, hey, I think we can do this. And that's what, even in science, my theme was more about, being able to connect the dots and work across multiple business units as well to be able to now come up with a solution. So I was head of the strategy at Science for the medical business unit. I was leading their new product development, as well as some of the corporate venture investments. So I think some of that again, was not a core part of my job description at that point. I joined as head of strategy, but I think a lot of things just fit in place because I was ready to take a lot more on my plate than what was actually initially given. Most firms will not do that. You join a function, but I think when they see a person, male, female, take a lot on the plate, I think, they also realize that, you are more of like a go-getter, want to get a lot of things together. So I think that job, was a fantastic learning curve for me. And I think what happened subsequently was that I think the AI ML engine at LinkedIn kept pushing this job posting for this VC firm. I think they realized that, I fit that job description very well. And I knew, the people at this VC firm from earlier from my startup days. And I just happened to write to them. It was also COVID time at that point. So I wrote to them and they said, why don't you apply? So I applied and, I think 10 rounds of my interview and, they said, okay, you are like the right fit and I joined them. So I really had to think that, at this late stage of my life, do I really want to do that, right? Like, do I really, and I said, okay, this is a chance that you're given only once. It's like a space shuttle. Do you want to get in or do you not want to get in? So, I think I took the plunge and that's how I got onto the VC journey. And then, of course, I see like cutting edge work happening, not just in India, all across. And I'll, probably go through and each of the things that you were mentioning earlier, have seen at least some of that or have worked in some of that spaces. And I sort of quickly go through and feel free to interrupt me. Happy to. I was hoping this is more going to be more of a, like engaging, two-way talk. But I think what I really, the NLP or like the whole AI space, what caught me was one of Google's talk when Sundar Pichai was talking on the Lambda, right? Like, being able to pass through a lot of text and being able to make out sense from that. So when I see a lot of patient records and a lot of startups come up with that, more of, and I'm talking from a US context, this will not happen in India until we have a digitization of your medical records, where, you actually see a lot of medical records and being able to identify parameters, like having a, history of the patient. So some of the work that I have seen and really impressive work, which would be the future of medical care, is that, let's say today you have fever and then you have cough, and then, but how do you delineate from having, COVID versus like a regular cough and what sort of cough? And let's say 6 months later, you come in again and see the doctor. So how do you actually go back and look at the previous medical history and be able to make sense? So this time, let's say the person comes with newer symptoms, comes up with stomach pain and fever. So, sometimes the doctor may miss it and doctor may not be able to backtrack and see that, okay, what does the fever and the stomach pain now have to do with, the cough and fever previously? Do I need to do XYZ tests? So the AI would actually go back and look at, give, based on the medical history and the medical databases that they have, that you need to go and do, XYZ tests, and then come up with, more tests to be able to come up with a medical, analysis. I think that is where the future of medical care is happening in the US. And there are several startups which are in this space. I think definitely a space to look out for, at least as a, something which is exciting. I think that whole conversational AI as well, again, speech to, because in US, you also have the doctors not, wanting to write a prescription, or like having all the medical records, if you can just speak it out and whether it can, translate it back to text and then, stored as a medical history, right? In India, until there's a law for it, I think we were not going to do that way because I think it was I think an act, Obama Act, which forced them to really put the medical records as more textual basis, which all the doctors hated, by the way. Basically meant for clinical trial observations. You look into continuous monitoring of these cardiac parameters, which got subsequently acquired by an Israeli firm. That was a very interesting one. In the pathology space, we had done from the previous firm that I worked at a VC firm, which was in the AI-based pathology space. I think a lot of them, I think you make these slides, again, a radiologist or pathologist has to see it physically. How many slides do you do per day? Like maybe 50 or 100, and you can mention how many of that. But so this was an AI-based microscopy where you would actually do scan the entire whole slide and then see the cancer markers or cancer cells and be able to flag it, which a really person who's like overly taxed for observing too many slides, you can easily miss out some of the cells which are malignant. So that was again in the slide space, but you have a similar one where it's X-ray or ultrasound-based one where you can do for cervical cancer screening as well. So a very interesting recent one which I saw was in the chemistry space. Now you have these like thousands and thousands of chemical compounds, actually millions. Now how do you detect, what are the interactions from each of these and come up with a novel compound? Again, Google DeepMind and some of these are like really cutting edge ones which have, deciphered protein structures. But then being able to come up with novel chemicals which are, let's say, in the green chemistry space, in the sustainability space. I think this is the only company of its kind in the world where they have, these are Harvard scientists who have come up with the interesting AI way of seeing the cement, be a green form of, let's say, the cement, which is, less emitting, less greenhouse, emitting carbon emission. So, I think the ability to be able to take, computer science or, let's say, chemistry into like really novel ways is, and then I think curiosity is like really most important. Being well read, while I love reading news, but then, can I connect The Economist, what's the article which is in Economist with something else which is happening in some other part of the world? Of course, I'm not, all these technologies, when I see the solution, I think while all these technologies are exciting, I think as a VC I have to ensure that is this monetizable, right? Can we make money out of it? At the end of it, it's not like cutting edge work which is going to really get funded. Sometimes it is also the team, whether they can really have the right set of people to make money. I think just like your business unit as well, right? Like you have to be able to sell the solution to client and then be able to monetize it. So, sometimes your solutions doesn't have to be like rocket science. It can be very simple solution. And I think that's what I think puts the, sort of grounds you as well, that, while as a scientist, I love to see breakthrough technology, but B, as a VC or a business person, can we make money out of it? So I think, again, connecting back the dots and being grounded, I think it keeps me grounded as well as at home as well. So it's important for all this stuff. And I think, so I think that's about it. I do have a lot more examples, but I'll just stop and would love to talk to all of you. And thank you for having me over.
Thank you. And again, resonates with everything that you said. In fact, How to Avoid Climate Disaster, book by Bill Gates, talks about green emissions reduction using some sort of a digital twin. So how can I create a component, how can I combine multiple molecules, generate something that will probably avoid this sort of a stuff. So the answer can be a bamboo house, the answer can be a cement that is less, emitting less poisonous stuff. So thanks so much.
One opinion that did come to me is when we're talking about drug discovery or healthcare, it is a question of life and death at the end of the day. And transparency of AI models is one of the biggest things that we have to work on. And one of the reasons why it was not adopted as early on was probably because AI was such a black box, especially to the end users. So how much of that have you faced, especially as a VC?
I think I'll speak from the Indian perspective, of course, because the US perspective is very different. In India, most of the VCs, and if you're, because you specifically mentioned VCs, don't come, is that all? Yeah, don't come from a science background. So I don't think you'll find like not even a handful, right? Like not even on a fingertip. So most VCs are either finance-driven folks, so they do not look at deep science. They will shy away from investing in something which they don't understand, right? So that will be the number one step. Why? First, I think your question was, why do we not see too many? And I'm probably covering, more than the adoption. I think they would be adoption, but you would not get funded because if they don't understand, they cannot scale that business, right? So I will scale, I will invest, and I mean by the larger community, into something which is a software-based, something which is easily scalable, something which is faster, because as we see, your turnaround time is, 4 to 5 years maximum, or maybe even 3 to 4 years. You want to put in your money, quickly exit, and what would that be? That wouldn't be drug discovery. That would be something which is more tried and tested, practical kind of model. But the newer generation of VCs, which are more science-driven, and I think VCs which are coming from outside as well, are interested in focusing on science, want more science-based, because it is also high risk, high return. Low risk, low return is the general mantra, and if it's high risk, there's higher chances of higher return, but there could be odds of, maybe out of 20 of your investments, maybe none of them will work, but one of them could work, right? And that could cover basically your rest of your 19 investments. So I think the answer to that is, I think the ecosystem here. But then I think some of the bigger firms, folks like Cipla, folks like Serum Institute, I think all Bharat Biotech have invested in science, and you see them making a lot of difference. I think folks from outside India as well are now looking up towards India to do some of these science-driven investments. And definitely India is a growing geography, growing economy. This is a place to really invest and grow. And I'm assuming hopefully that folks like Bristol Myers as well would have also started looking India as a potential geography which is growing to grow. I do know that you did have a presence in Bangalore, and then maybe this is a subsequent +1 of that. I'm hoping more MNCs would also come in, but having said that, Indian firms are really growing big, and there is increased focus with deep pockets of some of the Indian pharmaceutical companies, or some of the other medical devices is still growing, but pharmaceutical firm, this is the pharma capital of the world. So I have no doubt that this is for healthcare. This is definitely a geography to grow, and Hyderabad being really the pharma capital of India as well, this is something to look forward to. We may be building solutions for outside of India. For India, I think, at least from investment perspective, it's a bit slower. We do have a lot of diabetes disease management platforms, not like the Inulit kind of thing, but I think because India is also the diabetes capital of the world, I think a lot of these platforms are about disease management, and I think Abbott Libre and some of those devices on a continuous basis, being able to detect your insulin as well, or and then telling how much of your sugar, insulin needs to be pumped in, and along with your diet as well, right? I think because monetization will happen from the diet management part of it. So I'm speaking again from the business model. So I think as we see, we want to see how all these comes together.
Just had one point of view, I guess. When we all talk about explainable AI, again, it is our responsibility also to be a little more cautious about that, right? So a decision that a human makes, how explainable is that? Right? Meaning, let us also have some sort of, I guess, realistic expectations from machines. We've come to a stage where we are saying, oh, a machine has to explain everything. If the machine was supposed to be explaining everything, the human could have done it, right? But there is a specific reason why we're going to machines to get some of our decisions speed tracked, or but that's not to say that it needs to be a black box. It's absolutely critical to understand what sort of an algorithm is there. More than the algorithm, I guess it's about what sort of a data was used to build that algorithm, right? That gives us a lot of comfort. So you know, when you go to a doctor, typically what do you say? So she or he has already looked at this disease and she's been in business for the last 20 years. She's been treating patients with this condition. She's actually looked at somebody who's got this combination of diseases and she's been able to make a good recovery for that patient. So even in the machine learning space, AI space, I think we should stop getting obsessed about the technology. What is this transformer layer? How many, did we use ReLU? Did we use something else? What embeddings did we use? That's for the scientists to figure out. They will do that. But from a business perspective and from an explainability perspective, I think it is good to have openness. It is good to state exactly what your model is and what it is doing, what are the series of steps. But it is equally important to be open about the data that was used for training and what sorts of, how would I say it, some sort of a workflow steps that you would take if the algorithm doesn't make the decision, right? That's also extremely critical. So there is nothing like 100% accuracy. So what do you do when it is 80% accurate? So are you okay with 2 out of 10 diagnoses being wrong or 2 out of 10 clinical whatever tests going wrong? You're not going to be okay with it, right? So you have to have certain mechanism to address that as well. So explainability is a little wider than explainability just at an architecture for the machine learning model level. This is a favorite topic, so you have to excuse me.
Out of curiosity, we asked a question from our end to design a patient cohort for prenatal diabetes, and this probably connects the 2 questions I asked. It actually came up with a cohort, 0 women in that.
Yeah.
So who's going to tell ChatGPT that men don't get pregnant? So yeah, it is about not just the architecture, it's about the data, it's about explaining the entire
Absolutely,
thing.
absolutely. And again, that brings us that actually tells me there's something else that's extremely critical, right? So we're talking about lack of data. Generative AI, by definition, generates stuff. So why not use it for generating synthetic data? In fact, Zastra platform that Sai is extremely fond of, we have an in-house platform that we use for doing annotation, labeling for data sets. We are actually looking at expanding that platform into using generative AI for synthetic data generation. We all know that GANs have existed for a while, right? So this is just an extension. So why can't we use generative AI for that? And maybe humans are going to be at some point in time responsible only for generating data. And we should get paid for it. So all of us have to remember that we should get paid for all the data that we give. Sorry, you had a question, ma'am.
Yeah, I'm taking it from health to mental health. And if you really look at it, mental health is the space where there is a lot of speech to text and text to speech work that we can do. And globally, if you look at it, when you look at therapeutics, there's very little work other than, I don't know, which ChatGPT will bring up a little more, because then you don't need therapists, you probably need only the computer to generate it. But I still feel that if you really look at it, we depend a lot on the Western models of intervention. Whereas if you really look as a practitioner, there are very innate practices that are there, and which are, like in the West, you said you need 12 sessions. Probably in India, I'm telling you that 6 sessions, actually people are okay with 6 sessions. One is the payment, the cost, but also in terms of as therapists, we are feeling that people improve faster given the social connects that they have. And so my question here is that, can you throw some light on what is happening in the West in the space of speech to text in the space of mental health?
One which I really found interesting and was from the West was basically, first you get diagnosis, right? And because of COVID, the access to a lot of the psychologists were missing. So would the doctor would first refer to a drug, which is, extreme case, don't want to do that. So are there other interventions which can be brought in? And this was a gamification model for basically addressing mental health as a first step, as a first therapy before they would be put on on any access to psychologists, right? So that was an interesting one where gamification is being used for a lot of mental health issues. Of course, you can determine as well. I think people who are on a lot of social media, Facebook. There was an article a while back that Facebook basically knows much before even the person knows that they are going through depression, right? Because the kind of articles you are clicking on and things like that. So mental health, things like that I think there are different ways of addressing it. I think the interesting thing about this startup was also how they had access to the insurance. I think insurance is a big black box even in India, right? Like how is the billing done? Is there error in billing? I think billing errors are another big AI/ML ways of solving things. But I think insurance is another space which is being addressed from the startup space. Both, I think, big in US because that's a big, that's where the majority of the healthcare costs are being escalated. And then I think India, the way we are seeing, a decade back, how the billing was being done was more ad hoc. But now they are, I think we are following more of Western models, which is escalating our healthcare costs as well. I think this is a space definitely to watch out even in our country, especially the insurance space, how that's also escalating our healthcare. Unnecessary procedures, or it could be even round billing, right? Like you're being billed extra for things. So it's when you go into the hospital, you don't know how much you're going to pay. I think that's true everywhere now.
So there is a question, I think that can be relatable to Dr. Nita as well as Vani. So is there any ecosystem where all the pharma companies are sharing some kind of clinical data, masking few of the crucial informations, might be they're not revealing and they are onto their privacy policy. But is there an ecosystem where every companies are coming forward, mainly the big companies, big pharma companies, they're coming forward, they're submitting their data without hampering, or the trials which have been completed, the drugs which are already in the generic forms. And if those clinical trials are being submitted in a platform, that can be shareable to everyone, that can be open to everyone. So if we can apply some kind of statistics, some kind of AI, ML over those data, so that can bring up a lot of revolution. Because that will save a kind of spending over the failed clinical trials, over the budding startups, over the budding companies, budding technologies. So that can be a very drastic thing. And I'm from data analytics company. So I have seen many companies who are our clients. So they are very uncomfortable in revealing what they are doing. So that is, I think it's very common in healthcare, in pharma. But there should be some kind of common platform that will give a AI and ML to the next level. And that can be easily adaptable also. There should be some defined boundary, but it is required. What's your opinion? Because that is both the ways. That will lead to help to the new startups as well, and that will also help to the pharma companies in avoiding few of the spending which is not required.
Answer that I'm not aware of any such consortium where all the data is coming together. But then I think you just started a startup. So, that's how startups start, because you have an idea and it is a good idea. So I think it's like, how do you promote it and, find a cause for it. Mm-hmm. Yeah.
Or not.
And I think this is where the consortiums come together, no? Because there is some level of non-confidential things that people can share together. But, and then, of course, there is some confidential. So I think it is important to kind of bring it together to create that
vision of saying, hey, this is important to do. So yeah, it is a task.
Consortiums made, but for diseases like malaria and things like that, right? So something which is not core like neuroscience or cancer biology, because every firm is competing against each other. And having said that, none of the major pharmaceutical companies have come up with drugs from scratch from their own labs, right? They've all been acquired by some of the startups. So that's where the power of startups comes in, that you do your discovery, you go now that data is out there and you are able to crawl all that data with the ChatGPTs or the LLMs of the world, go look at the clinical data. Can you make sense out of that, right? I think there's an idea right there. Can you go look at the clinical trial data, published clinical trial data, which is published at NIH and all, right? So all those data, can you make, and I'm sure bigger firms are already doing that, can you make, find a drug like failed clinical trials, right? And that's why data from each of those trials is important, because how was Viagra discovered was, some person who was vigilant, can you go look at some of that data and come up with, discovery? And I think that's where, now that everything is exhausted, all the, basically all the drugs in terms of the discovery is being exhausted, can people go back, and that's what some of the big pharma is doing, to go back and look at some of their old clinical trial data and come up with newer forms, newer drugs, or which they didn't know had some of those side effects.
The last number is around 38 pharma, biotech, service providers, or about 50 share the data there. There's also Transmart, I think that is an IDP gap, which NIH sort of pushes for researchers, and that's where data is available. But I think to the point of legacy data by large pharma being used for the sort of research you're talking about, there was a challenge within the large pharma also, that the data was very siloed in functions. I think that is also being worked on. There's Data 42 by Novartis, for instance. Data 42 is an initiative.
So things are changing. I think data is becoming far more available. Now the question is, that's solved, how do you then make use of it? So yeah, that do talk to me if you want to know more about it.
Maybe there is a world where the patient becomes a custodian of data. So far the pharma companies, the clinical trial companies, the providers, the insurance companies, they have the data. Today you probably have a lot more power. Maybe you build that data. And if you are willing to share your data across different companies, and at some point in time there might be some startup that will provide a digital locker for your clinical trials data that can be shared across pharma companies. You get paid for it, and then you actually make data really, really democratized. Right? So that's probably an area to look for. Again, the drug discovery that they were talking about. Right? So there is another aspect to it. No drug obviously gets made from scratch. You're basically running each drug on a whole bunch of symptoms and seeing if it makes sense. So maybe there is an AI algorithm that does that digital twin equivalent, and for all you know, paracetamol might help cure something that you've never thought of. Right? So yeah, there's different spin that you can put on existing data that you've got, including social media data. I've had a project that I worked for quite some time back for Celgene, again a pharma company, and they used social media data to understand what the side effects of some of the drugs that they've released across geographies are. What are they talking about? A lot of people, for example, in India, you don't probably consider headache as a big side effect, right? So you're like, oh yeah, you took a medicine, you're bound to be, dull, yeah, 1 day fever, headache, it's okay. But then somebody in Norway might be very, very upset about something like that. So they actually use social media forums data to try and figure out what people were saying. And I heard it was being used in the mental health as well, figuring out what the symptoms for medication is. That's a big deal in the mental health space, right? Here you actually know what the symptom is. Has your pain reduced or not? In mental health, how do you figure out whether your depression is reduced or not? You only know it by symptoms, as in if you're not a practitioner. That is. And people have discussed openly in forums, and that's a wealth of data that we have.
And
sure
that's why
government
I'm
hospitals are
right,
outsourcing
post-marketing data analysis as a side effect.
And there was a study on Alzheimer's wherein it was a group data, and they looked at what were the early symptoms. And in that group, they actually came up and they said that it was not even sadness, because normally we are taught that you see depression before Alzheimer's. This was something like, but it was very, very unique and nice.
So I wanted to also add now is I think there's software as a therapeutic as well. So that's also being put up as like a FDA regulation. So the one company, the mental health one, it was being, they were going to get therapeutic, more as a therapeutic. The gamification was more as a FDA regulated therapeutic. So they were bound by, like that. Is there a progress in, when they play this game? Is there like deterioration? Is it helping? So they had shown clinical trial that it was, the gamification was helping in fighting depression or some sort of mental health.
Yeah, and for all practical purposes, we have government hospitals that are willing to give data, provided some very, very enthusiastic techies go there and digitize that stuff.
Right? I just want to make this thing. Earlier, as students, we were taught like how the patient is walking up and how she's looking at us, how the patient's symptoms are evolved. By then, we were taught how to diagnose a disease. Now all that is missing. Now it's all machine-based. Now it is all computerized. Now it's all algorithm-based and all. That human touch, which is missing. Actually, we were as a student.
I'm saying I see a big benefit in AI for that, because the very fact that the way you respond itself, you can pick up an AI. Because if you're being compassionate, your body language, the words that
so
you're
many
using.
diseases are diagnosed.
Yeah.
The thyroid and all, the voice you make, the gait which you are like working in, you're talking about the neuromuscular disorders, so all the simple things like the gait and all. They're all diagnosed just by looking. Our teachers used to teach us, like just by looking at the patient or the way he's expressing himself, or the majority of the diseases, even the
fractures and
everything was diagnosed.
Or even the color of his skin, right?
And the color of the skin, your pigmentation and the nodules, the diagnosis is already there. You need not run so much of so many diagnoses.
So there was a study in Lancet that I think 90% or even more.
That is the reason.
The new graduating doctors, both across the world, are not able to now use the old form of blood pressure machine, the mercury-based.
Of course, we were taught how to touch and then feel the pulse. So now it's all machine.
All digital. So I think the whole part of being able to perceive things is missing. Everything is digitized. So I think that human element is also.
The human element is missing.
It cannot be replaced.
Yes, we were talking because after EMRs came, like when you go to see a doctor, the doctor just looks at you for 2 seconds.
He's more bothered about filling it in.
And he's filling it in. And he's like, keep talking.
Keep talking, and then we digitize and do something else.
Between government hospital and private hospital, I've been in both. In government hospitals, still there is a personal touch.
There's a personal touch. Like we look at the patient as a patient, not as a machine.
You go to a private medical college, you see a different world.
Especially in Western and all, as Madam said, that they don't look at the patient. And if you have to wait even for acute appendicitis, it's an emergency. You have to wait till your machine decides what is happening. And these antenatals when you're talking about, and it's a big lot of a hole there. You don't get your appointment. That's an acute case. You need to address the symptom. And here, the doctor, if you come and patient is very happy, she sees, she feels that ownership of the patient, and then she diagnoses, and it's with one talk, everything is good. I mean, that touch is still there. Over here.
Sorry, I will do one more question and then we can continue the discussion. There's some snacks. That would be a good combination. So I just let her ask.
So I just wanted to add some thing to what ma'am was telling about mental health. So I worked on a project which was on mental health, and what we were trying to do there was using passive sensors to identify whether a person is under depression or not in a clinical study where we had diabetes patients who were under the study. So in diabetes type 2 patients, the rate of depression is high. So we took that as a clinical study data, and we handed over their phones, the sensor phones, which they were having a day-to-day life. And what we found was there was a high correlation between the difference in the person's communication or the number of calls he made. The entropy of it was very high when he starts talking to somebody for a longer time. So that is a sign of that he is going into depression. So that was very highly noticed. So what we came up with was a AI-powered chatbot, which is called Visa. It's currently in live, and it is being used in a lot of, even I think during COVID, it was the only bot which was allowed to be used in the whole world as well. So what this does is, from the AI flag that this person is not using his phone as usually he does, it triggers a chat to the person. So, are you doing good? Are you doing well? What was your day? So this is like it's not like acting like a doctor there, but it is just intervening to ask whether this person is doing well or not. And this is again, there is other, the direct physicians who are collaborating with this chatbot or the university, they go in for detailed study of this patient if they want it. So this is something where the mental health thing, and this was studied in India. The study underwent in India. Yeah, and it is now West. Yeah, now they have released it in UK.
Oh, okay.
I just wanted to share this.
It's actually happened.
Also have to be given opportunity.
I do not think that there is a clear division of men and women.
No bias.
So there is a big data bias happening here. All the women are asking questions, so I'll take one option. So this is for Dr. Nita. So whenever there is a general purpose technologies, right, comes into the world, like steam engines, printouts, electricity, there is a huge revolution, right? For example, there is a huge change in the economy, the social living of everyone changes, right? So now again, we are in the world where generative AI is taking again. So this is again a GPT, right? A general purpose technology. I'm not talking about generative pre-trained transformer. So when we see this new world, as a venture capitalist, everybody, whenever there is a GPT coming in, there is an initial thrust, right? People start experimenting themselves, trying to do new things. As a venture capitalist, how do you see this? And is it just the initial thrust where people are trying to implement new things, experiment things, trying to come up with something? But there is a huge difference between steam engine and an electric engine, right? So there is a huge time gap where people really experimented and come up with a real solution, right? So how do you see this new trend in people trying and experimenting a lot of things?
So, I think I'm going to go with Vani's example of she went to one of the conferences and every second startup was a AI startup, right? So AI was the buzzword. And the minute, I think AI was used as a buzzword to get the valuation higher, but we also know that that's a buzzword, right? And going back to your original question about ChatGPT, is it something which we're looking out for? I think we all have to understand that, we're not looking for tools for solving the problem. What we're trying to see is what is the problem that we're trying to solve? It's not the tools, right? Will you come with the answer to make this bottle? I want water, right? whether it's a plastic bottle or a glass bottle, I think that's the difference. I want water. So what is the problem that you're trying to solve? Is it these tools are making it solve it faster, cheaper? Then yes, I'm interested in understanding that. But otherwise, I want to know what is the problem that you're trying to solve. You can throw all those words at me. You can throw AI, ChatGPT. It doesn't matter. I want to understand, first of all, whether the person knows how to use it. What sort of team. What is the main, number one would be the problem that you're trying to solve, right? Who's the team? What's the monetization model? The tools comes like towards the later, right? Like when I know that, okay, the team can deliver, what are the tools? Is this faster? Is it making cheaper? Things like that. But otherwise, ChatGPT, conversational AI, these are, good words, but I want to know what's the problem that you're trying to solve.
So as we come to the end of today's session, we would like to extend heartfelt gratitude to the speakers for sharing their perspectives and helping us broaden their thought process on the art of possible in the world of AI-enabled healthcare. As a token of appreciation, we would now like to hand over a small memento to our speaker. So, requesting Urmila ma'am, Vice President of Corporate Service, to hand over the memento to Dr. Jayalatha. Ma'am, please. I would request Nanda Padmaraju, President of our Rest of the World Business, to hand over the memento to Vani. SVP Talent Development, to hand over the memento to Dr. Nita. So with that, we conclude today's session, and we invite you to continue the conversation over high tea and connect with the speakers as well as Cigniti team for a free willing chat.